The HPI is Germany's digital lab, and this forum is designed to bring together movers and shakers in the field of digital health. Together, we can accomplish more. Letting people get sick is not the answer. We need to keep people healthy. And to the extent that new technologies about collecting data out of daily life, coming together with digital data out of the healthcare system, allow us to develop new models, that is the motivation for HPI Digital Health.
Ask yourself the question, do you actually believe that your doctor really remembers all the details, pertinent details about you when you go on a visit? Do you believe that that doctor actually remembers everything about all the other patients in their clinic? I think we overestimate how good doctors are.
We already have a lot of the data science technology in place. What we're missing is the will, the education, and the infrastructure to deploy this data science widely.
We want to contribute as well in the research in that area of digital health, as well as educate people. This meeting brings high-ranked scientists, people from industry, our students together to discuss new developments and also to start cooperations.
The problem that I see is you're going to get treatment of metrics rather than treatment of real disease. Sometimes you have a symptom, you don't need treatment, but they treat it anyway.
It's very difficult to understand how this will be realized, how scientists will eventually get the data that they need to operate that data and then transfer it into the health systems that use it. But the number of obstacles leaves us rather bewildered.
My aim is to forecast mental earthquakes.
Right now, many people at the world don't have access to mental health treatments like psychotherapy or interventions. And I think digital solutions like just a smartphone actually could offer possibilities to support at the very first level, at the very first step, these individuals.
So the future of digital health, for me, there are a couple of components. I think one key challenge is the growth of data. It's impossible to integrate all this data, so we need to find ways. And also the holistic view about how much is the cost for a certain disease and trying to optimize this to make sure that digital health will simply become health at the end of the day.
What is health? Health is currently defined as the absence of everything we agree is a disease. We may all appreciate that healthcare service innovation is glacial. My oil change company, my coffee shop, pick any other service industry other than healthcare and do a comparison like this, you'll see dramatic differences. But in healthcare, it looks the same. Information technology, computer science, machine learning, artificial intelligence, these are the skills and talents that we need to bring into the digital health field to develop new solutions. It's really extremely important that an institute like HPI that has excellence in all these areas is able to embrace digital health and expose more students to these critical problems in the health field.
Now we have a brand new approach for digital health here in this digital lab environment. So I would predict the outcome can only be positive, and then we deliver real meaningful solutions of digital health for our citizens.